It's 10 o'clock. Good morning, everyone, and welcome. We're very glad to have you today for our event, which is a roundtable discussion about childcare, specifically the childcare crisis and recommendations on how to keep the North Country working. I'm Sylvie Nelson. Excuse me. And it's not COVID. I am the executive director of the North Country Workforce Development Board, and we have been working in cooperation with some of our local organizations on this very important issue. But before I go into it, I'd like to just go over some housekeeping, especially if you've just joined. If you can enter into the chat box your name and the company or organization you're representing, that would be great. I also want to make sure that you know that the meeting is being recorded, and that we will be forwarding to your attention later today this presentation, as well as the Child Care Coordinating Council of the North Country's Desert Report that will be mentioned today, as well as the links to the video and the article that Gary will be referring to in a little bit. So as we start, I would like to acknowledge our elected officials that have graciously joined us this morning. We are welcoming today Senator Little, Assemblyman Jones, and Assemblyman Stec. And later in the meeting, we are hopefully going to also have the visit of Congresswoman Stefanik, and she will be joining us at a later time because of the fact that she has to juggle a few things this morning. So whenever that happens, we will kind of break the meeting and have her speak to us, and then we will continue with our presentation, as she'll probably likely have to leave. So having said that, again, welcome. And why are we here this morning? Basically, this roundtable discussion is a follow-up to last October's North Country Business and Education Forum, where we explored the state of childcare in the North Country. And from there is a few initiatives that came out, including a survey that was sent out to the attendees of the forum. And additionally, as well, is that the Child Care Coordinating Council of the North Country published its Deserts Report with 3 specific recommendations included in there. And we will be unveiling them this morning and discussing them a little further. And although a lot of times people think that childcare is a quote unquote social issue, it's actually it's more of an economic development issue. And we've kind of seen that lately because of the pandemic, where childcare has become front and center as far as the workforce is going. Just the fact that we now have to juggle with children being in school, either hybrid, part-time online, part-time in the classroom, or fully online. And that has brought up some challenges that we a year ago would not even have conceived. So we'll be discussing that today and some of the things that we can maybe help address all those issues. And at this point, what I'm going to do is turn it over to Gary Douglas. Oh, but before I do that, I'm so sorry. I need to also acknowledge all the people that have worked onto this committee and that are bringing you that presentation. So we have Lindsay Turner from the Adirondack Birth to 3 Alliance. We've got Alan Jones and Kelly Leclerc from Adirondack Community Action Program. We've got Child Care Coordinating Council of the North Country, Jamie Basselier and Sarah Allen Taylor. We've got Gary Douglas from the North Country Chamber of Commerce. We've got Gabrielle Galli and Katrina Garand from the North Country Workforce Development Board, Justin Ein from the Plattsburgh YMCA, and also from the Workforce Development Institute, we have Greg Hart and Brittany Buffum. So thank you everyone who have worked very hard onto this presentation today, and I will turn it to Gary. Gary, do you hear me? Okay.
There, am I on now?
Yes, you are.
Okay, it's good to be on. As you can see, I have my attack moose behind me, so we'll try to keep everything very orderly. I'll also pass along the regrets from John Vanatten. He wanted to let you all know he may be in and out of the program as time goes on. He has a recurring problem each day. His tellers continue to set off the alarm every time a masked man comes into the bank. But hopefully he'll get a resolution to that and be able to stay with us. There's an old Chinese curse which says, "May you live in interesting times." Boy, are we living in interesting times. They're always interesting in the North Country, but we never thought they'd be as interesting as the times we're in right now. Going back, it seems like ages ago, but just 9 months ago to the start of 2020, we had a booming economy. We had a record start to the year in terms of things like sales tax revenue and job creation, occupancy taxes from the tourism sector. We had unemployment in the North Country as low as 3.6, 3.7% in some of our counties. And the key challenge and priority we were talking about was childcare. In terms of a growing crisis of capacity, enough places to meet the demand, affordability, even if there were places for them to be, those places to be affordable for working people and employers, and the rising issue of childcare as a key component of retaining and leveraging more women into manufacturing in an area where we happily are growing manufacturing employment, offering great opportunities for careers for women, but needing more thought and more commitment to the kinds of services that can allow that to happen. Flash forward 9 months, a pandemic later, the effective closure of our US-Canadian border. Now we're in a national recession, upwards of 11 to 12% unemployment. Many sectors struggling through very challenging reopening restrictions, still some not allowed to reopen at all. And guess what? Here we are, childcare, still a top challenge and priority. That hasn't changed while everything else has changed, but in fact has become even more urgent, but also more complicated. Indeed, our manufacturing sector in the North Country, largely with only a handful of exceptions, did not shut down. Most of it was considered essential and continued. Not only continued, but many elements of it were hiring and growing all through the last several months. So on the manufacturing demand end, that continued even while all of the other complications arose. People were reluctant to return to work. Many still are. There are concerns out there about testing and all of the things that feed into the psychology of getting things going, as well as the economics. We remain in need of leveraging and supporting more women in manufacturing, with the added element of lowering and making it possible for those who were employed in manufacturing and other employment to return to work, to be able to do so in the face of more complications than there were at the beginning of the year. Just in the last couple of weeks, the U.S. Chamber of Commerce released a report on this nationally on September 9th, piecing together solutions in essential industry for economic recovery. That essential industry is childcare, and a link to that document, as Sylvie noted, will be provided to you later. The system was already straining to meet demand, to recruit and retain employees, and control costs before all of this, and now it has all of the previous challenges, plus new heightened centrality to economic recovery. It was important in January. It is absolutely central to economic recovery now. So a more important conversation than it already was 9 months ago. Challenges to strain capacity from necessary spacing and safety rules. There already were capacity problems. Now capacity is stressed by the need to do things differently on the limited space that was available to begin with. A financial hit for our providers from lower numbers. They went through several months where they were largely closed or diminished in their operations. Revenue streams went down, yet higher costs came along in the face of also diminished revenues, just at a time when we need them more than ever. And dealing with unpredictability. You want to talk about things just like our schools are now reopening. Well, on the face of it, in a general sense, that's a great development for childcare, getting back to some sense of normality in terms of the school day, except wait, the school day isn't a normal school day. Some schools are remote, some things are remote, some aren't. Schools have different models for hybrid reopenings, which then involve schedules that aren't necessarily the normal schedules that parents are ready to deal with when their children are going to be in school. That has all complicated the the challenges of scheduling people and being able to even make childcare practical if they can basically access the services. So dealing with all of that unpredictability, testing, possible spikes, being ready for that, state variations, and how they're dealing with various sectors in the economy, as noted, some of which are recovering better than others are, and that impacts their ability to do the things that they need to do with their employees, plus such real life factors as the added stresses related to, for example, students with special needs. Stresses on these families, stresses on these young people in particular, and our child care providers need to deal with this. So that's kind of teeing up. I don't play golf, but my job is to kind of tee up the conversation, frame it in an economic sense as a priority for the region, but also how the challenges that remain, while a whole set of new challenges have come along that we all need to help our provider community deal with if we are going to rebuild our economy and if we're going to maximize economic opportunity, which continues to be on our doorstep for the people here in the North Country. We need more public investment. The governments are broke. That's an added complication when we need the investment most in this sector. It was already a difficult challenge in January. It's even more so now. So what do we do in the face of all of this? Hopefully this session can be part of a growing national dialogue addressing this on a region by region basis, while also feeding groups like the U.S. Chamber of Commerce and others on a national basis. And on the national basis, there's a greater consensus than we have ever had, I would suggest, in terms of the importance of investment in childcare. But then the challenges of how to do that when the federal and state governments are broke. So let the conversation begin. And Sylvie, thank you for the opportunity to jumpstart this.
Sylvie, this is Betty Little. Could I just say something? I have to leave. I can't stay on very long because I'm speaking at a memorial at 11 o'clock and they asked us to come early. So I thought I could be on longer than I can, but I have my office listening too. So, and we certainly will look at the presentation afterwards. But thank you. It's a huge issue, and it's so complicated in rural areas. And it's difficult, and we continue to see more and more regulations, mostly aimed at big city areas that we have to deal with. So thank you for doing this.
Thank you so much, Senator, and we appreciate the time that you took. I know how busy you guys are. If there's anything you want to add before logging off, that would be great. And if not, we can just go ahead and do a follow-up with you at a later time.
No, I'll talk to you afterwards. It's good. Anything I can do to help, I will do.
We appreciate your support. Thank you so much for joining us. So thank you, Gary, again, for that perspective. And now what I'm going to do is turn it over to Sarah Allen Taylor, and she will talk a little bit about the child care report, this deserts report that I mentioned at the beginning. Sarah?
Thank you, Sylvie, and thank you, Gary, for introducing today. So we're going to review the Child Care Deserts report that we actually issued in 2019, but to give a little bit of background on that, our agency, the Child Care Coordinating Council of the North Country, had gotten funding through New York Birth to 5 to assess the child care landscape in the North Country region, to analyze those findings and to make recommendations that were to be shared with the Regional Economic Development Council to be incorporated in their strategic planning. And I know that we have several friends from around the region present with us today. When I'm going through some of our stats, we're going to focus very specifically on Clinton, Essex, and Franklin counties in terms of what we're highlighting. But we did conduct surveys across the entire North Country region of employers, of working parents, and of child care providers. So all of the data that we have to share is based from our region very specifically. And to start with, the idea of looking at, Josh, if you don't mind going back to just one slide there, we jumped ahead a little bit, to discuss childcare settings in the North Country. A lot of times when people hear the term early education, they're thinking very specifically of preschool age children, children who are 3 or 4 or 5 heading into kindergarten. But as I said, the funding that we used came from New York Birth to 5, and we know that birth to 3 is actually the most critical time period for brain development for children. And we have 70% of children born today have employed working mothers. Working parents are about 30% of the workforce. So employers need those parents to be at work. And in order to be at work and keep the economy running, those parents have to have childcare for their very little ones. And this is really a multi-generational issue, because if we're looking at wanting to have a highly skilled and competitive workforce 30 years from now in the future, we have to be ensuring that the infants and toddlers today have the highest quality early care and learning settings that we can provide for them. So what that looks like right now actually in the North Country is that most care for our youngest children takes place in either a child care center, which is run by a director or an administrator. They have a larger number of staff. They'll have a number of classrooms with children divided up by age group. Or they might be in a family daycare home, which is a sole proprietor business, a small business, where that owner is the provider of direct care. And they may have one or maybe two staff members that work with them as an assistant or substitute, but that all takes place in their home with a mixed age group of children in a family type setting. We also do have UPK, Universal Pre-Kindergarten, or other preschool programs and Head Start programs available. For many families, when their toddler is aging up into those preschool programs, that is where they'll feel a little bit of financial relief related to the cost of childcare, but those programs are often part day, so even if they're able to attend those for free, it still leaves working parents struggling to find alternate care settings for the remainder of their work day. And then school age, once we get our kids into school, generally 8 a.m. to 3 p.m., working parents still do tend to need some before and after school care, which is what school age programs provide. And since we have experienced the changes due to COVID, this now means that with the remote and hybrid learning settings, those programs have suddenly faced all sorts of upheaval as well and have scrambled to kind of fill the gaps that has created for our older children. The final note I'll make about that is that in most areas around the state and other places in the country, child care centers are the predominant form of care. That's a little bit different here in our rural region for the North Country. We find that for children under the age of 5, we have about 40% of the total enrollment in regulated slots, those programs that are overseen by the Office of Children and Family Services. It's about 40% in child care centers, which is different from other places. However, if we lose even one program, one child care center, that leaves a much larger hole in comparison to the capacity of the overall system, and it affects far more families and employees. So the image that you see before you here is from a map from the Center for American Progress measuring childcare deserts. And a childcare desert is essentially an area where the potential need for childcare based on population numbers far exceeds the capacity of the regulated childcare system. And when we look at this, we find that 86% of census tracts in the North Country region are childcare deserts. There is not enough care to meet the demand. When we look specifically at Clinton, Essex, and Franklin counties, we have an average of at least 4 children that are considered likely to need care or have all available parents or adults in their household in the workforce, compared to each regulated childcare slot. So what does that mean? If we have way too many kids for these regulated childcare slots, it means that many families are forced to use unregulated or informal care, which could be, another family member, a neighbor, the person down the street, or they're potentially looking at illegal arrangements of care where the number of children that are being cared for does not promote the health and safety of children in that setting. So you're looking at varying quality, you're looking at varying stability. We've had 45% of parents of children under the age of 5 report that they've already had to change their child care arrangement in that short period of time. The alternative is that those parents can't be employed to their full potential. They need to be underemployed or unemployed because the children have to be supervised at all times. You simply can't leave a 3-year-old alone at home. Josh, we can go to the next slide, please. Thank you. So the infographic that you see in front of you, when we issued our deserts report in 2019, we did an infographic for each county in the region. What you're looking at today is today's statistics for the combined area of Clinton, Essex, and Franklin County. And we estimate that there are about 20,000 children of childcare age in this region. 30% of them live in poverty. And the average annual cost paid by a family with 2 children under the age of 5 is just over $15,000 a year. The median household income in this area is only about $50,000 to $55,000 a year. So those families are looking at spending as much as 30 to 35% of their income on childcare costs alone if they have 2 working parents. When we look at the ALICE report from United Way, that's the Asset Limited Income Constrained Employed Families, working families who are still struggling to make ends meet, United Way estimates that the survival budget threshold for a family of 4 with 2 children needs to be $78,000 a year. So that's about 300% of the federal poverty level. And again, looking at the childcare landscape today, we've had a major loss of capacity. In the past 12 months in Clinton, Essex, and Franklin County, we have lost 542 childcare slots. When we first did this report in 2019, attrition was already predicted to occur at an alarming rate. We had an expected decrease of 38% of family childcare homes as self-reported to occur over the next 5 years. And 65% of programs had said that there could be conditions that would threaten their survival for even the length of time that they currently expected. So this is accelerated rapidly due to COVID. Within the year before, in 2019, it was less than 200 slots that we had lost out of the system. So this is major, and this is going to be incredibly problematic if we lose any more programs. Josh, we can move to the next slide, please. So specifically, how does this affect the economy, employers, and businesses? So what you're seeing here before you is our local data. This comes very specifically from the survey of employers in the North Country. And what we found is that 90% of businesses report that they experience negative impact from unmet employee childcare needs. So what does that mean? It means there are work issues that affect employees and employers. We're looking at things like termination of employment or having an employee quit, that they're subject to warning or other type of disciplinary action, that they're unable to accept promotions or an increase in hours, and they often actually have to reduce their hours or change their shift. We have a number of employees that exhaust all of their available paid leave time, or they need to take unpaid leave time. They're missing multiple days of work or shifts in a row. There are regular absences or other unexpected interruptions to the work that should be accomplished. And what businesses find is that this affects their productivity. It reduces their profitability. It means that they don't have the same ability to retain the employees that they have or to hire new employees. And this is a really big deal. And comparably, very, very few employers are in any type of position to offer any type of childcare benefit to employees. And the other thing to note here is that all of this, the data that you're looking at on this slide, this was prior to COVID. And all of a sudden, the world changed. There was a major sudden shift. People got sent home, children got sent home, and this has left working parents, childcare providers, and employers in a total quicksand situation where everyone is struggling to keep their head above water. We can move to the next slide, please, Josh. And here, we'll take a few minutes to let you hear directly from the people that this is affecting. These are some of our child care center directors that will discuss what's been happening in the field within the past several months.
Nobody was really understanding the financial hardships that daycares were having before all of this started. And so it did bring that to light when daycares just had to start closing because they couldn't afford any kind of drop in enrollment.
The problem is in a lot of other fields, you have a product that you're selling. So your income is very different. Sales are up, you make a lot of money and things are good. But tuition, you can only charge a certain amount and you can only have a certain amount of people. So it's a fixed income that you're working with. And that's what makes it hard, because wages go up and benefits cost money and paid time off costs money and substitutes cost money and everything costs money, but you only have a very specific amount to spend. And that's the problem with childcare.
I think it's important that people know that childcare workers make minimum wage and that childcare centers struggle to pay minimum wage. We just start to feel like we're getting ahead, and then there's another minimum wage increase. And these people deserve to be paid far more than minimum wage. And it's really sad that we have to pay the minimum wage and are scared of minimum wage increases because we can't afford to continue to pay them minimum wage as it continues to go up. So I think it's very important. I don't think people realize how, and even our own families sometimes are surprised to hear that we earn minimum wage.
What I think everyone needs to realize is that the requirements on childcare programs have continued to increase every year as far as provider qualifications, training, various certifications and skills. And despite the fact that those requirements have continued to increase substantially, rivaling even those of certified teachers, we have certified teachers. We have nowhere near comparable pay or benefits. We have no one representing us. We have no union for daycare centers and for those employees. And we have no one to help us negotiate those things either, if we did receive funding from a federal level. There's increased requirements and no increase in the incentive. There are not new people coming into this field, even if they're passionate about it, even if they could be amazing.
They love the field. They're in it because their hearts are in it. They want to work with children. But when you look at how am I going to support my family, that's another ballgame. People have to pick a career that isn't just, small stuff here and there that gets you through. It needs to be implemented into our society as part of our culture that takes care of this piece to the puzzle.
It was kind of a double-edged sword. It was nice to hear that we were considered essential. But at the same time, it was very scary because, we were right in the front lines. And there wasn't a whole lot of guidance at first. Everything happened so fast that, it was very scary to tell your staff that you're essential, you've got to come to work. I'm sure they were nervous, but they just continue to do their jobs. And it really shows the dedication of the staff that they continue to come here, even through a crisis like this, because they're just such professionals, and it's time that gets recognized.
Well, we've always known we were essential. It's unfortunate that it took a pandemic for us to appear essential. We need to be at the forefront of the conversation because the community need is not met without the services we provide. The economy cannot recover unless there are safe, quality programs for children to attend. If there's no care, there are no workers. It's really that simple.
We need those people out there. We need the healthcare workers, and we need the people working in the stores and to keep things running. So it was important to us to stay open for those people, even though we didn't know how we were going to do it. We were able to work it out through loans and stuff. But, we felt like if we closed, we would never be able to reopen. And we knew that daycare is very necessary, especially in this area.
We lost $1,800 our first week of opening because we needed the staff here to implement new procedures and clean, but we didn't have the enrollment to fill them. And we can't do that. When the children are here, it's really hard to move furniture and put up barriers and change your spaces with a room full of children. So we kind of had to bite the bullet and set up shop, and we've slowly welcomed back our families. And although it was really hard financially, I wouldn't have changed that because it allowed us to test our procedures and make sure things were going to work and that the procedures that we were putting in place were long-term.
So we're starting to use more than one classroom for like our preschool program and our school age program. That's probably the biggest change. And then the second thing is the amount of extra that our staff has to do now, the amount of extra cleaning that has to be done. We're continuously cleaning. We have log sheets that we have to fill out. We have to be keeping track of everyone that comes in the building. It's for the contact tracing, a lot more paperwork. And, you know, we're expected to do all of this and still provide the same quality of care that we always have. So it's really added an extra layer of work for our staff to get through during the day, and we're still getting paid the same. You know, there's no hazard pay, there's no, you know, extra benefits, but it's what we have to do to keep going and to keep being able to have children in the building.
We were expanding our program coming into this year. However, now with group restrictions and keeping groups static, it's completely changed how our program can run. So as an example, my classrooms will hold 20 children. However, my group size that we can't go over 15 children. And if you look at the numbers with that, you think, well, that's 5 children, but that's 5 children that are each typically income-wise $9,000 a piece, which means over the course of the year, just for one classroom, that's a deficit of $45,000, which is the equivalent of more than one staff's salary and the rent for that room and half of your insurance for your facility, all wrapped into those 5 children. So it's a career for someone that's lost. It's 5 families that can't return to work without spots. And that's just one of my classrooms. That's not even the other ones. So it's pretty substantial. Childcare isn't affordable. Private pay childcare is what most of us do. Many of us accept subsidies, but they don't come anywhere close to the actual value of the spot. And very few families actually qualify for them. A lot of the working class families, which is typically who reach out to us, teachers, nurses, things like that, don't make the cutoff for any subsidy, but are also still working to make ends meet.
We've seen a lot of the middle class families getting squeezed out of daycare because the prices have had to go so high that they just can't afford it. So we either have rather wealthy families, or we have families that are through social services, and then that middle area has been driven out because they just can't afford it.
I mean, there is article upon article about why this is important, why childcare needs to be addressed. But I think we're at a stage where we need to start hearing back from our government officials. Why? We need to hear, why isn't it in the budget? And what can we do about it?
The truth is that this is not a sustainable format. The idea of private pay childcare is gone. It's not functional. It doesn't allow for the highest possible quality experience for children. It doesn't allow for the highest possible quality of life for staff. And it doesn't meet community need for the amount of care that's actually required. We need reliable funding that allows us to increase our margins enough to give those quality experiences to children and our staff. It's not possible to function in a survival mode, and that's how childcare functions. It's one day to the next, sometimes 1 week to the next if you're lucky, and especially during COVID, it's just shown that this model isn't sustainable. It's going to take us years to recover for those of us that even had the resources to survive this long. And if we don't have something to sustain us, even in the best of circumstances, we're not going to make it.
Thank you, Josh. If you can advance to the next slide when you're done there. So not to be all doom and gloom about what we're hearing back from our providers, but they have been struggling. And in having these conversations with center directors, as you just heard from Rose, those that could make it this long are the ones that had spent years building up a small emergency fund. And when COVID shutdowns happened, that disappeared in a flash. They are on the edge. They were already at the edge of the cliff, and we don't want them to fall over. But there has been some effort made at relief for childcare, specifically through the CARES money. And the way that that was implemented in New York State was essentially over 3 phases in terms of helping families and providers in the childcare field. The phase 1 included childcare scholarships for essential workers who were required to report to work during the otherwise shut down period. In Clinton, Essex, and Franklin County, this means that we were able to spend $115,000 to give 10 weeks of childcare tuition money for 89 children in 67 families. This first phase also included money for supplies for childcare programs that remained open: PPE, gloves, sanitizer, cleaning products. The approximate value of this was only $600 per program. Phase 2 was the New York Forward Reopening and Expansion Grants. There were a lot of hoops for providers to jump through to be able to get any of this money for their program. And it's still ongoing implementation. There have been some unfortunate delays in some of this. The range of what that actually provided to programs was anywhere from $300 to $1,600 for a childcare center. And again, this is intended to help, but it is really a drop in the bucket compared to what these programs need to remain operational and to sustain that for more than a short period of time. Phase 3 will be coming as of October 1st. Our understanding is that this will be implemented very similarly: additional scholarships for families, additional reopening and expansion grants. We're not sure how many of the programs here will be able to qualify for those grants. And the other thing that has happened recently is that local philanthropy has tried to step in to fill this gap and be able to be available where the red tape has made it a little bit difficult for programs. So things like small grants for small children and the SUN Fund, the Sudden and Urgent Need Fund from the Adirondack Foundation, have been trying desperately to keep these providers afloat in the meantime. And we'll move to the next slide here, please, Josh. So the recommendations that we're sharing today, again, in the original Deserts Report issued in 2019, we had some specific recommendations. We've updated this slightly for what we're sharing with you today. The previous recommendations were shared with the Regional Economic Development Council to be included in their strategic planning process. But essentially what we're looking at boiling this down to today is 3 very simple asks. We need to support families. We are looking at the facilitated enrollment program to expand childcare subsidies for working families. And in a moment, we'll give you some more information about that. We need to support programs. These programs need an immediate cash infusion without red tape, without needing to jump through hoops to get a little bit of support. And they also need long-term investment to ensure that they remain operational to support the economy and the workers in our region. And finally, we need to support the profession. This is going to require increased incentive for the development of new childcare businesses and to attract potential providers and childcare staff to the field in a way that they have a career because they're devoting themselves to service to our community. And we'll move on in just a moment here. I just want to also mention that we have seen previous success in this region specifically with a childcare pilot to pay tuition and fees for Alice families as a legislative grant that was sponsored by Assemblymember Jones, started in the fall of 2018. And this is where I'll turn it over to Brittany Buffum from the Workforce Development Institute to discuss the facilitated enrollment project and successes that they've seen with this implementation elsewhere in the state.
Thank you, Sarah. Sylvie, did you want to cut in here quick?
No, actually, we're all good to go. Thank you, Brittany. It's all yours.
Perfect. So thank you so much, Sarah, for providing the context to really demonstrate the dire need for quality, affordable childcare in the North Country. So as you all know, this issue is certainly not unique to the North Country or even New York State, but we're definitely seeing more attention paid to the issue. In the past decade, we have finally witnessed that shift where this is no longer solely just a women's issue. We have moved for it to be more of a family's issue, but we definitely still fall short on portraying a lack of access to childcare as the workforce and economic development issue that it is. So WDI's Child Care Subsidy Facilitated Enrollment Program was first established in 2003 in the 4 counties in the Capital Region, which are Albany, Saratoga, Schenectady, and Rensselaer. Knew I missed one there. And also Oneida County was on that same contract. We later expanded into Monroe County in 2003, Onondaga County in 2005, and Erie County in 2006. Facilitated enrollment differs from what is traditionally offered through the Department of Social Services, and that it serves families who would otherwise be ineligible for any other form of assistance. So these are your folks who sometimes are bumped off because they might have one overtime paycheck or they got a 5 or 10 cent raise. And while they might make a little bit more than the usual income guidelines and don't qualify for any other form of public assistance, they definitely don't make enough to make ends meet. With the average cost of childcare in the North Country at $15,000 per year for 2 children under the age of 5, it is very unaffordable, even with a good paying job. To date, the Facilitated Enrollment Program has served nearly 11,000 children from over 7,000 enrolled families. And this has helped to support over 1,900 small business childcare providers. The Facilitated Enrollment application process really works to adapt to the needs of working families. Applications can be sent via email, and evening and weekend appointments can be scheduled so that there is not a loss of work time to apply. This process is very inclusive and continually adaptive to what working families need at that point in time. So our facilitated enrollment administrators work very closely with the Department of Social Services and the local child care resource and referral agencies to ensure parents are receiving useful information and to also be a resource for the community to support the existing child care infrastructure. While we can't emphasize the importance of the quality of the child care program enough, the reality working families face is that they are forced to focus more heavily on the cost, the location, and the hours of operation when selecting a provider. As you can see on the screen here, facilitated enrollment families report that as a result of enrollment, 52% were able to afford housing or transportation, 48% were able to pay outstanding bills, and 27% were able to afford increased nutrition. These statistics should really be a wake-up call for everybody that childcare subsidies can mean the difference between having the ability to put food on the table or not. In addition, 59% of families report improved attendance, 49% report retention of employment, and 47 report increased productivity in the workplace as a result of enrollment in the program. Facilitated enrollment is a multi-generational support that is a sound investment with a high rate of return. For every dollar invested in childcare, it is estimated that an additional $1.86 is generated in additional spending. This is equal to or better than return on investments in other major industries such as construction and manufacturing. When we invest in our children, we invest in our future by ensuring they are receiving the resources necessary to build strong foundations that will support them for their entire lifetime. Subsidies have become even more vital for working parents as they navigate hybrid schooling schedules and the increased demand for childcare coverage that was traditionally covered by schooling. Childcare will serve as the pillar of our economic recovery because without it, we all know that parents can't work. Our children deserve to have equitable access to quality childcare, and our childcare system desperately needs the resources and programs that provide income for our providers and viable workforce pipelines for the childcare system. Facilitated enrollment is just one way that we can keep the North Country working, but we definitely need the support of everybody on this call to make it happen. So from here, I'll hand it off to Jamie, who will let everybody know what they can do to help us make this happen.
Good morning, everybody. So I am here today to respectfully ask our elected officials, Assemblymember Jones, a dear friend, Assemblymember Stec, Senator Little, to support a legislative add into the New York State budget this coming next year, of $1.5 million so that we can launch a facilitated enrollment of childcare programming using subsidies from that $1.5 million to support Alice and working families' childcare tuition. This is a really big deal. We would like to ask for this 1.5 million for our region of Clinton, Essex, and Franklin counties. And as one little additional small favor, any red tape that any of our elected officials can cut out of this CARES money administration, we would be most appreciative. And so would all of the frontline childcare providers and programs. That's the ask for today.
Thank you, Jamie. So as we're moving forward now, we would love to hear from our elected officials who have graciously joined us today to listen to the state of where the childcare is at in the North Country. And I'd also like to take a moment to welcome Congresswoman Stefanik, who just joined us during the presentation, and I will turn it over to her at this point to make some comments. And also, Congresswoman, if you have any questions, please feel free to ask them.
Well, thank you so much, Sylvie. Can you hear me all right? Great. Thank you to Sarah, Brittany, and Jamie as well for taking the time to walk through this presentation. I know my staff is tuning in and has been taking notes. This echoes much of what I'm hearing directly from constituents, but also I'm hearing this from employers. As we are working to safely reopen and safely jumpstart the economy, childcare is absolutely essential. And I was tuning in when you had the video presentation of some of the childcare providers and child caregivers. They are absolutely essential. They are what I consider frontline workers and really rose to the occasion during the pandemic. And this has spotlighted how important they are and how much we need to support them. Thank you to Sarah, who walked through some of the key provisions in the CARES Act, which was bipartisan legislation signed into law. That 10 weeks of childcare for essential workers, that was really critical at the height of the pandemic. In addition, working with New York State to get these grant dollars out to the communities is very, very important. Jamie, when you talked about getting rid of the red tape and some of the bureaucracy, we absolutely need to do that because our region and the unique challenges we face are very different than other parts of the region of New York State. So we've got to get rid of that red tape and get as much funding directly to the child care providers as needed. And it really is a crisis, and I want to work as a team with our child care providers, with our local chambers, as well as with my state elected colleagues to address this. A few updates on federal legislation that I think is really important, and one of the bills is actually on the floor today. The bill today is called the Ensuring Children and Child Care Workers Are Safe Act. I am a co-sponsor of that bill. It will pass. It requires the Department of Health and Human Services to provide states updated information and best practices on safely providing childcare services during the pandemic. In addition, it provides $5 million in grants for states to get that information out there. That's important because during the presentation in the videos, one of the childcare providers talked about how that lack of guidance and the patchwork approach, that has been very challenging for our childcare facilities to work through. So that is important. Key is funding, however. In addition to the CARES Act funding, we clearly need more funding. And there are a few different legislative vehicles that I'm supportive of to get that done. The first is making sure that we come together on an additional COVID bill. I have advocated for bipartisan compromise to get this done on behalf of the American people, but on behalf of the North Country. In terms of state and local aid, I'm on a bill called the SMART Act, which would provide $500 billion for states and municipalities. That is really important because that will help address some of the COVID-related fiscal challenges that we are facing at the state and local level. Specifically on childcare, I crossed party lines to vote for the Child Care is Essential Act. That established $50 billion for Child Care Stabilization Fund within the Child Care Community Development Block Grant. I've been a big supporter throughout my time in Congress of the Community Development Block Grants, and we need to make sure that there's a specific focus on child care because that's what many of our community agencies have been focused on right now, because that is clearly a need. In addition, I voted for the Child Care for Economic Recovery Act, also crossed party lines to do so. That provides an additional $10 billion to the states through the Child Care Development Fund to allow us to expand our child care facilities in response to the pandemic. So we are going to continue working on this. I know that the direct aid is incredibly important, both to the child care facilities, but also to New York State and local governments because of the financial challenges they face. So I just want to, again, thank everyone on this call for their incredible dedication to this issue. We are hearing you. I am hearing this from, as Brittany pointed out, not just working women, working families and employers across this district. This impacts everyone. This impacts our local economy. This impacts our education, our mental health, and our economic and health recovery that we're working as a team to get through this very challenging year. So thank you very much. I'll turn it back to you, Sylvie, so we can hear from our state electeds.
Thank you so much for your time, Congresswoman, and for your comments and your support also in this very important issue. And I think I said it at the beginning, childcare is economic development, and I think that you definitely highlighted that point. We, like I said, appreciate your support. So having said that, I believe Senator Little is offline now. And so if that's not the case, if someone, if she wants to just say something, just to let me know. If not, the next person on the list to speak today and to offer his comments is Assemblyman Jones. And again, we thank you for your attendance today, Assemblyman. It's all yours.
Thank you, Sylvie, and thank you for hosting this very important forum. And as was presented in the video presentation, and as you have said and Jamie have said, reach out to your elected officials, make them hear you. Believe me, we hear you. I know my colleagues, Elise and Dan and Betty on this call, do certainly hear you. As far as funding, that is essential to all of these child care programs. And as Elise had mentioned, we desperately need, and I know Jamie put that legislative ad in there, and certainly we will work on that. But to provide that, we are certainly going to need the federal aid in the next stimulus package. And Elise, I know, is a big supporter of that. We need that, and the conversation definitely needs to be revolving around that as well. But on the state level, we can and should be doing more. In the Assembly, every year we put forth a very robust child care package in the budget process. And unfortunately, through budget negotiations and with the executive, it dwindles down. And that's I'm not trying to make an excuse, but you do have allies in the New York State Assembly that really push forward to that, as well as many legislative bills, legislation that can help child care providers. There are many bills that I co-sponsor that do just that. This is an issue that stretches across from all income ranges, believe me. Certainly it affects Alice households a lot and more, but you know, I feel that I have a pretty good child support system, or a support system here. And I often have those oh crap moments where I say, what am I going to do with my daughter? Things fall apart. So I can only imagine how much more that is magnified with families that don't have that support system as well. We will continue to work on this. Please continue to advocate on this as well. I was just talking to someone the other day. We had realized how important this was pre-COVID, but I was just talking to someone the other day whose husband has a good job. She has a good job as well. And with the programs that are in school now with the hybrid models, she has to rely on another form of daycare at the school in a very good program, and they try to make it as affordable as possible. But she's going to leave her job. She's going to take a leave of absence for her job because, quite simply, she has 3 children. They can't afford the necessary extra childcare that they're going to have, and all 3 children are in school. And she's going to take a leave of absence. They both have very good jobs, but it certainly is going to hurt them economically. She works for a good company in the Plattsburgh region, and that hurts the company as well, because obviously she's not going to be able to be at work during her leave of absence. So we do realize this affects our businesses. It affects our families. It's not just a social issue anymore, as was mentioned. And as Elise had said, this is an economic development issue. And Gary had said earlier, and we certainly do hear from you. Please continue to advocate on behalf of our families. We are listening. We need to get that funding into these budgets and into the stimulus package, as Elise had mentioned. We will continue to fight for it. And I feel that we are making progress on this. And I feel that overall, as a society, people are seeing how much more important this is, especially during these times. So thank you so much for having this. Thank you so much for all the work that you are doing in this field. And our childcare providers are essential. This is an essential service. And too bad it took a pandemic for us to all realize that. But thank you so much for everything that you do.
Thank you, Assemblyman Jones. We certainly appreciate your support, and I think that there is some work that we can do to help make sure that there is adequate funding during budget season so that we can hopefully alleviate this crisis. As we move forward, I am happy to welcome Assemblyman Stec for his comments. If you can just unmute yourself. Thank you. I'm hoping he's here. It's supposed to be. And if not, yeah, I don't think. If he's not, that's fine, because I think that he would echo exactly what the Congresswoman and Assemblyman Jones have said. We're very lucky, I think, in our area to be able to work with elected officials that understand the issue. And you know, in the end, it's really about money, and unfortunately, at this time in history, we're confronted to quite a bit of lack of funding. However, I think that through some work from our end as a group, that I hope that you, all the elected officials, can consider your team on childcare. Then we can help you achieving that. The other thing I wanted to mention is that our next step as a committee is to really morph ourselves into more of an advocacy committee, so that we can be that voice for you, and that we can gather all the different supporters and key players into this issue, and then have our voices heard in Albany and also in Washington, and so that we can get things moving on this, on the childcare. And then what I'm going to do next is to make sure that all the attendees receive the presentation and also the links to the video and Gary's article. And if you have not done so, if you can just go ahead and enter your name and your company or your organization you're representing into the chat box, we'll be sure to follow up with you on that. And if you also want to participate on this committee as we're moving forward into a more of an advocacy group, please feel free to reach out to us. You can reach out to Gabrielle, who sent you the invitation today for this roundtable discussion, and then we will add you to the list. I think that the more voices that we can get, the better off our cries for help will be heard, and hopefully things will change, and then we can serve those families and those children, and make sure that we as a region can be a key player in the economic recovery, and childcare is definitely at the heart of that. So having said that, we're right at 11. So I appreciate your time. Our elected officials, thank you so much for your support. Thank you for your understanding, and we look forward to working with you in the future on this very important issue. Thank you, everyone.